Mental health groups rallied outside the Ohio Statehouse Friday, asking the Ohio Senate to restore money for mental health awareness advertising campaigns back into the two-year state budget currently being debated. The state budget, already passed by the Ohio House of Representatives, had $36 million over the biennium into the Ohio Department of Mental Health and Addiction Services budget for statewide prevention, treatment, and stigma reduction campaigns, education, curriculum, and services for children and adults in the Ohio budget bill. The Senate took that money out of their version of the budget, saying the $18 million a year can be better spent on treatment programs rather than advertisements.
We think that nearly $40 million worth of television commercials is much better invested in programs and services at the local level that really helps the people that are struggling with mental health and addiction really get the services that they need and deserve.
Well, it's not only advertising, it's education. It is, kids especially spend a certain amount of time in school. However, you have summer breaks, you have winter breaks, you have all these other times that you're actually in the community, and we need to make sure that this is a message that's environmentally heard and not just something that is heard in schools. So hearing it on billboards, hearing it on the radio, that's where a lot of folks are going to get their information, and that's why we would like to see this put back in the budget.
Cindy Price's son Tim took his own life at the age of 39. She is now an advocate for suicide prevention and mental health awareness. She wants the advertising dollars to stay in the budget so efforts that have helped reduce the stigma she says surrounds mental health can continue.
When my son died 10 years ago, suicide was a stigma, and I've worked very hard to make it now more approachable. You can talk about it more. People don't go like that and don't want to talk to you. Yeah, I think suicide's more out there. People are more willing to talk about it now.
Today is much different than it was 10 years ago. Society is much different than it was even 5 years ago. And these types of issues are much more out in the open, much more recognized. And we think that it's a much better investment to take the dollars that you might see on a TV ad once and get that money right into the programs that really make a difference.
What Fortney and Price do agree on is that early education is key for suicide prevention and mental health awareness. Fortney says that is why the Senate's version of the budget has an additional $500 million for mental health programs in K-12 schools.
We need that education and the information to pass out. We need to be able to go into the schools and give them the information.
We want to be able to invest directly into the programs that work, and much of that starts at the local level. And that's one of the reasons why we thought the additional $500 million directed toward K-12, you want to get in front of the problem as soon as possible.
Governor Mike DeWine's proposed executive budget included the $36 million for stigma reduction campaigns. A spokesperson for his office said Friday the governor has always been an advocate for mental health programs and preventing childhood suicides.